All right. Hello, everyone, and welcome back to the Dental Hygiene Basics podcast. My name is Dana. I'm your host, and we have a special guest today. And she's actually not a dental hygienist, but she is a former dental assistant. And I'm so excited to talk about her career progression and to dive into the ADEX exam. So we have Miss Shayna Overfelt with us today. Thank you so much for being here.
It's my pleasure. It's my pleasure.
Yes, I'm so excited. And before we hopped on, I was like, okay, I'm pretty sure you're not a hygienist, but did you work in the dental space? And you start telling me your story. I was like, whoa, okay, I want to hear about this. So tell us a little bit about how you got to where you are today.
Absolutely. So I am a certified dental assistant through Danby. I worked clinical chair side for 15 years. Then when my dentist retired, I went into dental sales. So worked for Benco Dental, sold some supplies. I then ended up in practice management, did that for a little while. But licensure space, Dana, I have been here since about 2005. So while still doing other things within dentistry, licensing became a part of my life. And then from there grew into this position of now a senior director of licensing here at ADEX.
That's amazing. And I don't know if I just see your face everywhere because I know you and I'm like looking for it, but I feel like you're all over the place. You're doing webinars with Student RDH, you're on social media, helping students get prepared for licensure exams. And so I'm just so excited to have you here and honored that you're going to talk to my audience a little bit. Now, some students who are listening, they may just be applying to dental hygiene school. They may be an assistant and not know what's possible. So I love that, you're showcasing a whole different avenue of career path, whether you're an assistant or a hygienist. But beyond that, when you get ready to graduate, you have to take a licensure exam. And you are a big role in ADEX, which is a main licensure exam. So can you tell our listeners a little bit about what ADEX is? How does it work? What type of exams are the students going to have to take to get their boards? Or get their license, sorry.
Yeah, no. So as we look at this nationally, so our business name is the American Board of Dental Examiners. We administer the ADEX examination. So most students see that in the licensing of what's required and ADEX examination. This exam really is your clinical licensure competency assessment. That's what it comes down to. And it comes down to, from an ADEX perspective, the exam is two parts. It is a computerized OSCE examination, which allows that student to shine in their critical thinking and the things that they're doing in clinic today, from patient assessment, medical history, charting, intra and extraoral exam. Then we bring the hand skills, that clinical assessment for those candidates to then test on a simulated patient within their own clinic or a clinic that they signed up to take an exam.
I love that. Yeah. So if you're listening and you're embarking on a dental hygiene career, unfortunately, the exams don't just stop with dental hygiene school because you do have to take this national licensure exam to get your license. And then you may have state requirements as well. So it depends on where you live, right? Well, okay. I know for me, I am blessed to be an examiner with, I guess, the American Dental Board of Educators, but I always just say I'm an ADEX examiner, which is so much fun because I get to travel around and grade the manikin exams. So that's one aspect of things that I do. And actually, I got into that because I was on an airplane and I was sitting next to a hygienist. This was before I even went to dental hygiene school. And she told me she was traveling to grade the exams. At that time, it was patient based. I had never even known that that was like something that you could do as like a little side hustle. So it was really cool. And then as I got into education, one of my amazing mentors, she got me into the examiner space, which has been so much fun. So I know what it's like from taking an exam myself, right, to get my license. But also I'm behind the scenes. No one ever sees me because I'm tucked into the examiner room. So explain to students what the flow of the exam day looks like so that they can kind of picture that.
Yeah, and I'm going to grow on what you said, Dana. It's been exciting to watch you personally grow in this space, not only here, but your podcast. I mean, you talk about me doing other things within dentistry and dental hygiene and dental assisting. You as well have matched that step by step of making sure you sign up.
Thank you.
So, and show up, I guess is the better term. But from an exam perspective, as you asked, here's the thing about exam days. It will be a day that you remember for the rest of your life. It will be the story you tell, whether you took it 10 years ago, 20 years ago, or you're taking it tomorrow. It's an experience that I really, from here, why we provide a simulated patient today, which has made that exam much more standardized process for those candidates testing, which is really to their benefit and to the benefit of the profession. It's not as stressful, Dana, as it probably was when you had to go find a patient and you were looking for that perfect patient for an exam that wasn't too hard or wasn't too easy and to be accepted. Now students have a patient that we provide that is standardized. Everybody's doing the same clinical competency on the same skill set across the country. So from an exam perspective, this really does change the game that the student can bring their best day in clinic to an exam day and provide the best outcome possible, leading to success in their clinical licensure exam.
I love that. You mentioned everyone has an exam day story, so I might as well share mine while we're here. Yeah, I had to find my own patient. I didn't find mine, I think, until a week before. So I mean, you pay for the exam, you
Yeah,
have the slot scheduled ready to go. If you don't show up with a patient, I mean, they don't give you your money back, right?
yeah.
So I found a patient. She owned the bar down the street from my house, and I was like,
I've heard bar stories.
yeah, I walk in, I'm like, "I need a patient." She's like, "I'll do it for you." I was like, "Wow, okay." But she was great. I passed, so all was good. But it's so much stress whenever you have those processes that you have to go through. And I love the ADEX exam for that reason that, like you said, it's standardized. You get the mannequin, you show up and your patient is there and they qualify and they're not going to be dismissed. So once you show up, I'm assuming you get checked in, you go to your mannequin, you have to bring instruments, all of those things. What does that kind of look like?
Yeah, so I do like to in webinars and even in my my little small world of making these, I do walk you through the day and kind of mentally paint that picture. But you're right, you're going to show up to that clinical examination. There will be an exam team there to greet you. From there, you're going to show them your ID, prove who you are, then they'll let you in the exam. And really, past that door, you then become your candidate ID number. You stay anonymous to the examiners, and the examiners who are with you on the floor are there to support you. They're there to give you their best as well, so that your experience is one that you're happy to tell when you leave. Those examiners on the floor aren't the ones who are grading you. They are kept separate from you, our examining team. So they never know who you were. You get that anonymity within the examination, which we all want. You show up, again, you get 2 hours to take the clinical examination. You're performing calculus detection, calculus removal, and pocket depth measurements on the clinical hand skills assessment. There's not Dana, the one thing everybody's worried about is there's somebody standing over my shoulder. As they would be asking, is Dana going to be, as an examiner, standing? And there's not. The examiner lets you make your clinical decisions on how you're best going to treat the simulated patient on exam day. So once the exam begins, you're free to, some candidates like to stand, others like to sit. One of those top questions, ergonomically, am I being graded? You are not. The patient needs to remain in a normal position. But outside of that, the examiners are there to make sure your day goes smooth.
I love that. And that's one thing that I always see when I travel on these exams is the support from the staff and the people that are there, like you said, to help the exam go more smoothly. And it's a stressful experience, whether it's a mannequin or a human, but to have people like that there to be your source of support and, like you said, just make sure it goes smoothly, I think it is a huge benefit to the students. And so thinking through some of the tips, I'm sure you've heard crazy things that students have said, like, don't do this or make sure you do that. Do you have a crazy tip that you're like, don't worry about that?
I do have I have several. I've got one that I've come up even with my own tagline. So out there in social media, typically, unless it's coming from either myself or, it isn't always the best advice. And I have seen some things and heard things. And one of those things we addressed for some time, I'll actually give you two examples. One of those is that to avoid tissue trauma in this examination, you can bring dull instruments. That was the advice. So my tip became kind of a growing on that to say, yes, if you want to avoid tissue trauma, you can bring dull instruments, but you will also avoid calculus removal. So you cannot remove calculus with dull instruments. So you will accomplish two things that do not lead to success on this exam. So sharp instruments are your best friend in this exam. The secret is the proper adaptation of that instrument into the sulcus that then leads to successful calculus removal.
Yeah, absolutely. I that was actually the one that was on my mind because I've
Yeah,
seen that so many places.
yeah.
The thing is, students go out and they look for resources. Where do they
Sure.
go? They look on Facebook forums, Reddit threads, they're asking on TikTok, and people are just commenting. And the thing is, you don't know who's commenting and saying these things, and they may not
Yeah,
really have the best idea of what is best. And you've worked with this exam for years and years. I know you're familiar with the calculus, the type it on. I've examined, so I know what the calculus and everything feels like. And I'm like, no, do not
yeah,
show up with those blunt instruments. And like you said, the most important thing is the technique. You think students say, are they watching me? Are they watching my ergonomics and the way that I'm positioning and the way I'm adapting? No, we're not watching any of that, but it shows up in the on the typodont if you weren't doing those things, right? And
absolutely.
yeah, you may save the trauma, but if all the calc is left behind, you're not going to pass the exam.
That's right. That's right.
Yeah.
The other one that comes up a lot is a lot of questions around the ultrasonic. And the teeth in the simulated patient have been designed to withstand an ultrasonic, just not at its highest powered setting. We don't need it. It's not that type of calculus, and it's still a simulated tooth. So, but in this conversation point, some people say only use your Cavitron, and I cannot stress enough that that is not setting you up for success. You at least need to use both tools of hand scaling and your ultrasonic. You could only hand scale if you wanted, but just to come in with only a Cavitron typically does not lead to success from a student performance. We at least need to use both of the skills that we have to be successful, or hand scale only.
That it's straight from the horse's mouth. I trust you because you do this every single day. But I feel the same. I think about that in regular patient practice. I think about, like you said, these typodonts were designed to mimic as much as possible real scenarios. And when I think about, well, how do I treat a patient? I'm going to follow the same proper pathways. I'm probably going to use both Cavitron and hand instruments. I'm going
Huh?
to make sure my technique is correct. I think the thing is, we start to stray away from what we know, and that's where the mistakes happen. You start to think this is different. The test isn't the same as real life. And while it is a mannequin, the process still applies. It's still the same.
Yeah, it is still the same. And like I said, your best clinic day will be your best exam day. Bring that mindset. My big takeaway in my webinars that I host is that I want you to leave with the confidence that you're prepared for the exam. Faculty wouldn't have you sit for this exam if they didn't think you were ready. Dana, the other thing you mentioned I think is important is these students have an opportunity to do this as students. That didn't always, you used to have to graduate, then you took the exam, and then you were waiting 6 weeks or more to get a license. Now it's integrated within their school most of the time, not all, but most. It's close to graduation or just before. And then you've got that opportunity to take that exam as a student. And if for any reason you're not successful, you do have 3 attempts, but you have faculty there to help you get through and prepare for that next attempt. So I always say, don't let, if something does go awry, don't let that be your trying to determine who you are as a dental hygiene professional. We just got to get over this hurdle, reassess, and retake that exam the second time.
I love your verbiage because that is all about what dental hygiene basics is. It's like the struggling student, like where, and I mention all the time, I talk about the hurdles that you have to overcome. Nobody had an easy hurdleless path to where you ended up, right? And in the field of dental hygiene, usually you hit multiple hurdles before you get that license. And so I think that's such great advice. And okay, so talk me through a little bit. If you do have an unsuccessful attempt, you mentioned you have 3 more. How does that work? Is it 3 more total and then you cannot test again with ADEX, or walk me through that?
Yes, sure. So for the examination, we have 3 attempts. Your initial attempt is one, and then you have 2 retakes built, as part of the process of getting the exam successfully completed by the end of 3 tries.
Okay.
So as I mentioned in the beginning, exam is 2 parts. It is that computerized OSCE. There's 3 attempts allowed on that exam. Then your clinical component, you also have another 3 attempts to be successful there. So each stand alone in that 1, 2, 3 element of being successful. So if you are not successful on this examination, we actually give you and tell you the points where you lost points. So faculty also gets the same. So they're able to assess, was our issue in calculus removal, calculus detection, pocket depth measurements, and then they can coach you through how to maybe adapt that instrument properly. They can advise. That is the biggest tool in being able to do this within your clinical setting at your own home school. So yes, you get 3 total attempts. First is considered initial, and then a second and third attempt if necessary.
Okay, and so what happens if you get to the third attempt and you're unsuccessful? Do you just have to repay to test again, or is that 3 times and you're out?
No, there's not 3 times and you're out, but it does become a little more complicated as far as what a state board might look at. When it comes to actually applying for a license, state boards and the American Board of Dental Examiners has a beautiful national score portal that most boards use today where they go get your scores. So any exam that you take, whether it's us, national boards, jurisprudence, all your scores have to be reported. So the board does know how many times you've taken this exam. So if the board has policies of how many attempts you can have before you have to show a remediation, that is something that you'll have to look into. Dana, I'll step back and give you a statistic really quick. In the clinical examination for our students, our current graduating class, about 95% of them do pass this on the first time. So I don't want to overemphasize this unsuccessful, but I like to say if you're not the first time, just get prepared for that. Take the time to just regroup. Walk in confident that second attempt to be successful at that.
Yeah, that is amazing advice. And that's what I was trying to wrap my brain around. I think you answered it beautifully. The thing is, we're not here to tell you be prepared for the fail. We're really saying be prepared for the success because the success rate is very high. And I know the OSCE, the computer simulated exam, the first time pass rate is also very high. So that's very promising. If you're listening, you're getting ready to test, I want you to take that with you. But as I always say, I'm a second time girly. I wasn't into I didn't get into dental hygiene school my first time applying, right? There's always a hurdle. I work specifically with students who have not been successful on exams like
Yep.
ADEX or like the national board, trying to help them overcome that. And usually, eventually they get
It
there.
does.
But there
Yeah.
are some limitations that you may have to check in with your state board, like you said, because they may limit how many times you can take it before maybe you have to take some type of remediation course or something like that. So, good to know, but also not a need to know until you're there.
And the other thing, I in the simulated space, and the students who are listening to this now, right? To go back in history and understand where this came from. There indeed used to be a patient element where you went, Dana, you just spoke to that, to go find your patient, bring them in. And now that seems to be lesser of a standard in simulation. You can testify to that. I can testify that it is actually not a lesser value. It is a more standardized process. So the exam itself has been developed from top to bottom by dental hygienists who did take a patient-based exam. They know the scrutiny of that, but also realize there were some downfalls in all of that. So having a standardized test that we can give, Dana, there were almost 5,500 dental hygiene, just the students alone who took ADEX last year. So we know the majority of students take ADEX, and they're all being tested on a same entry-level skill set.
Yeah.
That alone should give the profession resolve that everybody who's getting here is clinically entry-level skill set, proven that they're competent.
Yes, absolutely. Yeah, and what the students don't realize behind the scene when it's being examined, you have 3 people that are checking, right? And people have to agree. It's not just like one, it's not just me back there like
Yeah,
deciding your
going,
fate.
just go,
Yeah.
right, right.
Yeah. It's a very rigorous process on the backside. The algorithms, I get a report every year. It's like it tells
Yeah.
me how I perform compared to others. So there's a lot of really interesting things behind the scenes. Like there's a lot of thought that went into this.
Yeah, and what students don't realize, Dana, is you as an examiner also had to go through a test before you're even allowed to examine these students. Like your part in this is also evaluated. Every examiner within our culture take that same standardized test as well, making sure they're ready to look at the student's performance from the same perspective.
Yeah, absolutely. Now, you mentioned, I think you said 5,500 students took the
Yeah.
ADEX exam last year. Once you take this exam, can you just briefly talk us through reciprocity, like going from state to state with the ADEX
Yeah.
exam?
So that's one of our biggest talking points. One of the advantages that I encourage students to take the ADEX exam is the portability that comes with it. Now, portability is a big word right now amongst the profession. And what does that mean? It means a couple of different things in different contexts. But from an ADEX perspective, all but 2 U.S. states accept the exam results. So what that means for you as a student, and I'll use my own home state of North Carolina. If you're in North Carolina and you want to go to South Carolina, you live on the border, both states accept this exam. So you do apply in both states for a license so that they know that you're there. But other than that, you can go anywhere across the country except for those two states. And I'm not going to mention them because I believe there's some change coming. So depending on when you're watching this, it might actually be accepted everywhere at that point.
Great.
That's the beauty. And traveling hygiene is we're watching that increase. So, and a lot of times, if you watch those TikToks of our traveling hygiene friends who are making content, they took an ADEX exam, and that's allowed them to just move and not have to retake an examination at every state. So it just checks all the boxes for you. It leaves the door open. Dana, I never thought I was leaving the state of Texas, and since I've lived in Georgia, North Carolina. So you just don't know. You don't know where you're going to end up. No need to have to worry about it. Take one clinical exam and then take that success and move across the country.
Yeah, and that's different because when I took my original licensing exam, it was the Western, like reciprocity and portability. I could only go to like Arizona, New Mexico. There were certain states, and not to say I could only go there, but I could only go there if I didn't want to retake a clinical patient-based exam.
Yeah. And even before that, it was individual states.
Yeah.
It used to be, even if you were on the border and you wanted to practice across that North Carolina, South Carolina border, the example, you'd have to take a whole nother exam and go find a whole nother patient. So portability, if you haven't looked back at clinical licensure in some time, our students are going to have the advantage and not know what it used to be. But that's their win. That's a win that the profession has given to them to be able to pass something forward. That this exam doesn't have to be repeated every time you move.
I know, and I love that you say that because we think about, well, how did it get to this point? It's because people care and they want to make, life easier for
Yes.
hygienists to move. I mean, there's so many reasons why people move, but I mean, you think military. I'm in
Yeah.
San Antonio, Military City, USA. We have new people coming in from different states every day, and then people going out to different states every day. And it's just like, I can't imagine how hard that would be. I've never had to do it. There was only one time where I thought I might have to move, and I'm just like going through those requirements, like, oh man, this is going to be, a tough
Right.
slug. But I think it's so great what you guys are doing, and wonderful opportunities for, like you said, the future of our profession. Well, do you have any final tips you can think of to tell the students?
Again, my biggest thing is mindset on exam day. Go in prepared to be successful. Listen to the webinars that are here to help you. Read the manuals. Cannot stress that enough. They're short. It won't take long, but do know what's in them. Your mindset in preparing yourself, not the night before, but a little bit at a time, listening to some of these content that is now more readily available than it had ever been before. And just, students, you're more ready than you think. Everybody wants to tell their story of what their exam was. It doesn't always come out from the ones who were successful. They just take their thing and keep moving. So don't always take the negative and just trust that you're more ready than you think.
Yeah, such great advice. And everyone's experience is unique. As you said, we all have our own
Yeah.
story to tell, and we all have our own individual stressors, whether you pass or fail that exam.
Yeah.
So yeah, stay in your lane. Don't worry about everyone else, and go in confident. I love that.
Yeah.
Well, Shayna, where can people find you? I know you're posting amazing videos. I see them on TikTok, but where can people
Yes.
find you?
Yeah, you can find me on TikTok, Shayna Overfelt, at Shayna Overfelt there. I also have some really nice videos of candidate expectations and the candidate experience video on our adextesting.org website under our test prep section. So lots of things you can find there. Webinars are there for you to check out. TikToks are much smaller in size and content. But, honestly, Dana, the class of 2025 asked me to start it, and I did, those TikToks. And the interaction of a candidate with me directly has been phenomenal. They'll message me when they've passed off to the side, their excitement. I get to share in that. So it's been a very valuable part of my own life to participate on another level than just a one-time webinar interaction.
Yeah, I can see that. I can see that absolutely. Well, thank you for all you do and for spending time educating our students in this process. And yeah, we're just so grateful for you. Thank you, Shayna.
Thank you, Dana. It's been a good time. Good luck to you, students. You've got this.